Hello, I am Harold Rosen, and I have the pleasure to be the editor-in-chief of Hamdan Medical Journal. Today we will talk about incontinence. That means the loss of control of the bowel or the bladder. This is one of the most important issues with ongoing age, and a large number of people who cannot stay at home anymore for this disorder will suffer from this problem. However, in the recent past there has been considerable progress, and one of this progress is a new method called sacral nerve stimulation. So I'm very happy to have one of the experts in this field, Professor Brigitte Kovanyi from Vienna, who will tell us a little bit more. Hello. Can you tell us what is sacral nerve stimulation?
SNS allows a continuous stimulation of nerves and muscles in the pelvic floor and give you the opportunity to select those patients who were suffering from incontinence. The charm of this method is that you are able to select those pelvic floor nerves supplying organs like urinary bladder or bowel. Patients who might be candidates for sacral nerve stimulations will have a test phase of about 10 days to 2 weeks. And then, if you have select those patients who profit from this test stimulation phase, can be implanted with a permanent implantation comparable with a permanent pacemaker implantation.
Thank you very much. As far as I understood, this is a quite expensive method. So when it comes to this, there is also always the question, how is the evidence level and how is the scientific evidence of this new method?
Based on a very high level now, good results, especially in patients with fecal incontinence based on so-called unknown idiopathic etiology, can be regarded as evidence level 1 to 2A. That means that we have results of a randomized trial comparing the outcome of patients treated with sacral nerve stimulation compared to those patients treated with conservative therapies only.
Okay, thank you. And if you tell us about indications, what kind of indications beside urinary incontinence, which is a very well-established method today, there comes the question in bowel control, in fecal incontinence, who are candidates today for this method?
Beside those patients who suffer from sphincter damage and who do not respond to conventional surgical repairs. We have also observed in our own working group significant results in patients with neurogenic dysfunction like spinal cord injuries after spinal cord surgery or trauma. In those patients, sacral nerve stimulation was able to affect fecal and urinary incontinence in a high proportion. Sacral nerve stimulation is a minimal invasive technique, and we feel that at least the acute needle test should be offered to everybody today.
Thank you very much for sharing your expertise with us. Thank you.